over in Bafoussam.
And as we announced in this newscast, Professor Patrick Nana Sinkaam is a cancer specialist. He will be talking about breast cancer, cancer of the uterus, and more. But before we get to that, Flora Jingla presents to us a little package about cancer in Cameroon.
The Cameroonian Ministry of Public Health has estimated that 25,000 people in Cameroon are suffering from cancer and that every year 14,000 new cases are reported across the national territory. Women are mostly affected by cancer, as only at the Yaoundé General Hospital 66% of those sick of cancer are women. According to the World Health Organization, 3,800 men and 4,400 women died in the year 2014. The same report indicates that prostate cancer and breast cancer are the #1 killers. Quite scary figures, which makes people think it's better to be HIV positive than to be a cancer patient. Despite the numerous sensitization campaigns carried out, the subventioning of chemotherapies in Douala and Yaoundé by the National Committee for the Fight Against Cancer, there is still a limited access to infrastructure and adequate resources. In Cameroon, there exist no cancer centers nor a permanent unit of screening to discover cancer at its early stage, yet health centers can help reduce mortality rate linked to cancer, which stands at 8,000 individuals a year due to the illness. The illness can touch just anyone or any human organ, yet many conditions to be avoided predispose people of being affected: lifestyle, alcoholism, obesity, tobacco consumption, change in hormones, and taking no or less fruits, no exercising. These factors go a long way to developing cancer in a human body.
And he is right here in the studios with us, Professor Patrick Nana Sinkaam. Good evening and welcome in course of our newscast.
Thank you for having me.
You just watched the report. Any reactions to the report you watched on figures of cancers in Cameroon?
Yeah, well, it's interesting to see that because, as we were discussing before this, the incidence of cancer is actually on the rise in the continent of Africa as a whole.
Yeah.
If we look over the continent, what we see is that in 2012, there were over 850,000 cases of cancer in the continent of Africa. Over the next few years, we will see that number probably double, and there are several reasons for that, as was pointed out in the story. Cancer is very complicated, and there are several factors to why cancer increases in terms of its incidence. One is the fact that prevention is necessary in cancer. And when I talk about prevention, I'm talking about vaccinations, changes in lifestyle that were mentioned, diet, exposures to fuel gases, as well as other environmental exposures, and as well as genetics. Secondly, screening is very important. What we know in all cancers is that early detection leads to early diagnosis, leads to better outcome. The third factor has to do with effective diagnostic strategies. The reality is that cancer can be a very expensive disease. Chemotherapy, diagnostic testing can all be very expensive. And when we're talking about a country such as Cameroon or even the continent of Africa, that can become a major obstacle. The fourth has to do with effective treatment. We heard in the story that chemotherapy, while necessary, is not always available in many parts of Cameroon. Chemotherapy is very expensive. When we look at the statistics, less than 5% of individuals who would benefit from chemotherapy actually receive chemotherapy. And the last is palliative care, and the need for palliative care for those who have advanced disease and need pain control.
Without actually cutting you, I know you've actually elaborated a lot more on cancer. Why is cancer recurrent in Africa? Why? Well,
there's several reasons. One is the fact that we see a higher incidence of certain infections here on the continent of Africa, and we now know through a fair amount of investigation that there are associations between certain infections and cancer. So if we look, for example, at the fact that cervical cancer is very, very common on the continent of Africa, more common and actually more deadly than, for example, North America, we know that there are links between the human papillomavirus and the development of cervical cancer. Human papillomavirus vaccination has been shown to decrease the incidence of cervical cancer by as much as 65 to 70%, yet we do not yet see widespread vaccination among young individuals for human papillomavirus. Another example would be liver cancer. We see high incidence of liver cancer on the continent of Africa, and we know that there are direct associations between liver cancer and hepatitis, yet we do not see widespread vaccination for hepatitis on the continent of Africa.
And how can we prevent cancer in our local landscape? In Cameroon, many reports say maybe the way we feed is so poor. How can we prevent the outbreak of cancer in our local landscape?
Yeah. Well, it comes back to prevention and education. We know that there are links, for example, between obesity and several cancers, one of the common ones being breast cancer. So starting to raise awareness within the communities, the local communities, about diet and the fact that obesity contributes to cancer is one. The second is the fact that there is increasing amount of investigation suggesting that antioxidants can actually decrease the incidence of cancer. And when I talk about antioxidant foods, I'm talking about certain fruits. Things like berries, for example, have been shown to curb incidence of cancer.
And you just talk about feeding habits. What about what we take, like you watch via the images, a cigarette, tobacco, and all of that? It also exposes a lot of people to get cancer.
Absolutely, absolutely. We're seeing a rise in tobacco consumption on the continent of Africa, particularly among young individuals, and it's clear that many cancers are associated with tobacco consumption. The second point that I will raise is the fact that secondhand smoke is also known to be a risk factor. If we look across several epidemiological studies, what we know is that secondhand smoke actually increases the risk of lung cancer, for example, by as much as 15%.
What do you mean by secondhand smoke? Because the viewers out there maybe will not be understanding it like you and other health specialists. What do you mean by
So when we talk about secondhand smoke, we're really referring to being exposed to a smoker within a close approximation. That may be someone who's living in the same home, an individual who may be in the same workplace, and you may be spending time with them and being exposed to secondhand smoke. And also, we talk about secondhand smoke in various public arenas, for example, at bars and restaurants and other public venues.
And what about the new methods to screen cancer in Cameroon? Do we already have it on the field?
Well, we don't quite yet, but over the last 10 to 12 years, we've been very interested in developing some novel tests that can be used to diagnose and to screen individuals for cancer. The goal is really to start to identify those people who are at the highest risk for having cancer and then provide them further diagnostics, because we know that widespread screening cannot be sustainable from a financial perspective. So we have been now developing blood-based tests that really require a single drop of blood that can be used to start to screen individuals for such diseases as lung cancer, liver cancer, and even cancer of the prostate.
And just to know, what makes the difference in the spread of cancer in Africa and Europe? What makes the difference?
Yeah. Well, I think one of the biggest issues is that cancer on the continent of Africa, many patients tend to present very late in the course of their disease. As I'd mentioned earlier, once cancer is identified very late, in a late stage, while there are options for treatment, the outcome tends to be quite poor. What we see in other parts of the world is that there are more efforts in the area of screening and early detection, which as a result leads to lower or better outcome in cancer.
If there is a single word you want to say, or last word you want to say to the viewers out there listening to you, maybe what's the last message you want to send across?
I think the last message that I would like to send across to the viewers is that cancer can actually be avoided. It can be identified early through proper prevention, vaccination, awareness, education on diet, and also a consideration for screening. Many cancers that we see on the rise in the continent of Africa are actually easily diagnosed through very simple screening methods. Breast cancer, self-examination; cervical cancer, pelvic examination; prostate cancer, prostate examination. All of these, when done in the proper individuals, can lead to saved lives.
Do we have probable programs on the ground for the prevention of cancer in Cameroon? Any?
Absolutely. So what we're doing now with the Sinkaam Foundation, the Charles Sinkaam Foundation, is that we have started over the last year an actual screening day where individuals can come for free and can actually be screened for several of the cancers that I mentioned: cervical cancer, breast cancer, and prostate cancer. And it's really our hope that this type of community-based screening will take hold across the country and hopefully lead to many lives being saved.
Thanks a million for coming. And
Thank you.
Maybe we'll see you next time for more information.